Hi friends, this is BHUSHAN NEMLEKAR on DC Celeb Talk, Dicer Connect, and it has been a long time that I have connected to a guest. So we have started this Pathfinders, which is supposed to be a very nice concept where there are people who are experienced in a certain field and they speak about their profession. And if there are parents or students who would like to connect with them, definitely they can connect later on to take their advice or Now today I have got a distinguished guest by the name of Dr. RASHMI NAIK MHATRE. Why I got confused, because Aniket MHATRE is my friend. So RASHMI NAIK MHATRE, she is the wife of Aniket MHATRE. Now I would like rather request Dr. RASHMI to speak about yourself. She's a dentist by profession. So could you just speak about and elaborate as to how is the entire system about?
Hi, I'm Dr. RASHMI NAIK MHATRE. I am the Chief Dental Surgeon at Impressions, the dental hub.
Yeah.
I've been practicing dentistry for the past 16 years, Daisar Madhets. And I'm a graduate from Nair Hospital Dental College.
Great.
After that, I've done a lot of courses on implant dentistry, and I've been practicing implant dentistry since 2008.
Yeah.
So, and I would really like to thank you for giving me this opportunity to be on such a platform. Thank you so much.
Great. Actually, my intention to have started Dicer Connect is to get people like you on board, so that everyone knows that there is Impressions Dental Hub which is existing at a good point. Though everyone knows, because your clinic is at a vantage point and you're a good doctor, you're a good dentist. So obviously the name spreads. But still, even if it's a or maybe Akshay Kumar, you require people to speak about their film. So I thought, like, within Dicer, why not Dicer Connect and invite guests like you all? Over a period of time, Dr. RASHMI, we have seen that whatever was there when I was small, to go to a dentist, we used to get, because the only thing was they used to pick up a, I don't know what is it called, and they just remove our molars or the other set of teeth. So going to a dentist was like a nightmare. But you have seen as a next gen, where you have seen a lot of changes in technology. So how do you, advise people? A smile is very important factor or aspect of a human personality. So do you think that having a proper upkeep of one's set of teeth is more important these days, and the technology really helps it?
Of course, having a good set of teeth, it's not just for the cosmetic reason or not just because it looks good. It's very important because it really improves your quality of living. It's not, now it's, now we are becoming more aware about, the aesthetic part of it, how a smile is supposed to be, whether someone has a little yellower teeth or someone has a crooked teeth. But when we look at it in the overall perspective, it really helps us improve the quality of life, your chewing capacity, your function, your speech, everything. So having a good set of dentition is a very important and a very critical aspect of healthy living. That's what I feel. And nowadays, with the advancement, earlier, of course, like you said, it was always so much about you visit a dentist and most of the procedures that were just plucking out the tooth. Now with the advancements, we are more advanced. We have removing a tooth is always a last option, because whatever is natural and whatever is always we always try to conserve it, preserve it, because anything artificial is always artificial. And when you can save a natural tooth, I think that's the best thing to do.
Okay, so that's why there is a lot of you go in for implants and various other root canal. These are certain kind of treatments which you are given. I think I presume they are affordable also. My question is, people get a little worried if you go for a root canal. I'm asking you, how many days does it take, or maybe for an implant, or having a bridge to be fitted? So does a person have to be going without a set of teeth, or maybe a gap of 2 or 3 teeth in between for a couple of days, so that they have to actually wait for the imprint and the implant comes after that? The set is fitted later on?
See, I'll clear out a few doubts about, a lot of people have this misconception that, root canals are very painful. Firstly, implants are very painful. Implants take a lot of time till you get your tooth. So firstly, let's talk about root canals. Root canal is a procedure which is done to save a decayed tooth. So it is done under local anesthesia. It can be done even in one sitting, or it can be done in multiple sittings, depending upon the amount of infection that is there in the tooth and around the tooth.
Yeah.
So, and it is done under local anesthesia. The post pain is always taken care of with painkillers, with over-the-counter painkillers that are available. So it's definitely not, it's not like a painful procedure that, one has to be on a leave or, take a leave to get a root canal done. Definitely not. And nowadays with the advancement, because we use more advanced equipment, the techniques are more advanced. You can almost painless procedure, a root canal. And implant is basically an artificial, it's a replacement of a missing tooth. So implants, when we do implants, we can restore, we can give you a temporary teeth even on the same day that implants are done. But that is something which the doctor can decide depending upon the amount of bone which implants are used. So every patient may not be able, to get his teeth right on the day the implants are done, but it is definitely possible. It's definitely possible.
Great. So you feel personality of the person is reflected by the kind of, by the set of teeth he or she has, how she or he maintains it. Is it very important? Because nowadays the entire scenario is changed. Presentability, or it's very important. So what is your advice as a dental surgeon?
Definitely, your smile is like, I think, like how I always keep saying that, a smile is the best curve that you can flaunt. So recently there was a picture which was circulated on WhatsApp, in which there was like a man, he had one missing eyebrow and one missing tooth, but the missing tooth was the first thing that always catches your eye.
Right.
So it is a very important and a very integral part of your personality. It boosts your confidence, the way you smile, the way you
look.
The way you look. Yeah. Of course, that is entirely on what our smile designing is based on. So it definitely is a boost to your personality.
Great. So my next question to you is, by default, do you have a lot of youngsters coming to you, so that they should look good, be presentable, and retain their 32 teeth, as they call, Battishi, as I hope everyone has got 32 teeth. I don't know if anyone has got 30. So you can also clear that myth if I have, asked you a question.
Yes, we do have a lot of youngsters who come in today because they want a good aligned set of teeth. They want whiter teeth. What I usually recommend to my patients is, your first priority always has to be function. Because sometimes, like, we have a lot of actors, actresses who have a tooth which is not aligned, which comes, but it does suit their personality. It does give them a very beautiful smile. So the first thing always is about function, whether you can maintain it well. Even if you have a little malaligned teeth, are you able to maintain your set of teeth well? Of course, looks for for kids who wish to go into, different fields, aviation, where it is important for them to have, of course, for them, that's the priority. But otherwise, your function is more important. Look at the overall aspect of your teeth, whether it's really required bleaching. If you want really whiter teeth, but if you already have, existing sensitivity in your teeth, then bleaching is not ideally recommended. So it's the doctor should ideally advise these youngsters, what they should go in for, and whether it's really advisable to go in for those kind of treatments.
So it's so nice, actually, my dear friends, my dear viewers, those who are from the younger generation, do catch up with the proper appointment with Dr. Rashmi Naik MHATRE, because she can guide you as to how to maintain your set of teeth. And if you really require some kind of alignment, or she'll not just misguide you, she'll guide you in a proper way. My next question is about the youngsters also itself, doctor. See, there are a lot of younger generation, the kids mainly, who are into junk food. They eat a lot of fast food, which is and aerated drinks. So, what do you advise them? Is it at a very early stage the set of teeth are damaged because of that?
So, junk food, it's something which is more processed. So anything which is going to remain on the surface of the tooth for a longer period of time is going to cause tooth decay. So the junk food that they eat, or eating at odd hours, wrong eating habits, all these things, of course, are going to make the food stay on the tooth for a longer period of time, causing tooth decay.
Yeah.
Aerated drinks are going to cause, the enamel of the tooth, that's the hard covering of the tooth. In a normal, way to explain it, the enamel of the tooth gets eroded, and that is going to cause a lot of sensitivity later on. So for an advice for youngsters is aerated drinks, however good and however, cool it sounds, it's not a very good thing. So it's best to stay away from aerated drinks, because it causes more tooth damage than anything else.
Yeah, it becomes a style statement, statement where they feel that they are having a aerated drink, like maybe an actor or actress. But I think in general, it is, my dear friends, it's not really advisable. You could have some other, I say drink in the sense, you can have juices of some fruits which are probably healthier, rather than having these aerated drinks. Dr. Rashmi, one more thing which always comes up to my mind is this younger generation, I'm not saying everyone, there are exceptions, indulge in a lot of smoking, okay, or maybe alcohol. So is it, are these two factors again responsible to spoil the overall look of the teeth?
Yes, so smoking definitely causes a lot of staining of your teeth. Smoking can also lead to a lot of gum issues. There can be a loss of tooth. Eventually, smoking can lead to oral cancer as well. So smoking is definitely not good for your teeth, and not good for your overall health as well. Alcohol, a lot of times, is mixed with a lot of aerated drinks, or the sweet juices that are added on, that are had with alcohol. So anything in proportion is, I would say, is okay, but anything that is overdone is always going to cause harm to your teeth and your overall health. Smoking, definitely, smoking has, it has a lot of adverse effects on your teeth. The stains that are caused by smoking, that's probably the most minimal aspect of it. Smoking usually reduces the saliva content in the mouth, which is responsible for the natural cleansing of your teeth. So that, of course, it does affect, it may lead to tooth decay, it may lead to a dry mouth. All these things are going to cause a lot of oral health issues.
Great. Actually, Dr. Rashmi, the best thing is, because of this technological development and these kind of interviews, what we have, it's easier for us to reach out to the younger generation to make them understand as to how they should maintain their set of teeth, which is which take them throughout their life, which is for their longevity also. I don't say so other things or caps, though they are artificial, I'm not against it, but I think they can still retain their natural set of teeth if they take care of them from their childhood, isn't it? What do you say about it?
Yes. So early detection of any kind of tooth lesions, any kind of decay uh, is always better because it can be handled well. There is no loss of tooth that occurs, and a periodic dental checkup is something which is very important, which we've been consistently emphasizing on, because your first dental appointment is ideally to be scheduled when the first milk tooth erupts.
Is it?
That is, or before before the child's first birthday.
Okay.
So this is something that, not many, new mothers are aware of, because that is when your teeth have to be taken care of. That is when the entire process of, oral hygiene starts, where how you're supposed to clean your milk teeth when in an infant, how you're supposed to clean the teeth when the child is a toddler, how you're supposed, the amount of toothpaste that you're supposed to use, which brushes have to be used. So all these things is, when it's taken care of, when you're a child as an infant, when you build that habit in a child of brushing twice a day, gargling after every meal, that will help you, retain your teeth and keep them decay free for a longer period of time.
Great. It's so nice that, like, as I told you, we just grew up naturally. I mean, whatever we are today, we had no such institutions or, doctors who would come and tell us about it. So, for the next generation, I'm very happy that there are people like you, taking care of their personality. One more thing I would like to ask you, it's not a doubt. I just want to know, there are something like wires which are there, which are fitted for the teeth sometimes, which come out. This is a question. Alignment, yeah. I just thought about it while we are speaking. So how painful is it? Is it very painful when you put it across the teeth, and then do they align properly once it is removed?
Yeah, so what you're talking about, they're the orthodontic correction. So we are talking about braces.
Yeah.
So braces now, earlier they used to have metal braces. Now with more advanced materials, available, the braces have become much more painless. The time required for the correction and the alignment of the teeth is also reduced. There are various options available. Adult orthodontics is, picking up really fast because of the invisible braces that, that's the newer thing which has come up. So the correction is, we get 100% correction. What we are expecting, when it's done in the younger age group, when the bones are more softer, the movement of the teeth occurs much easily. Within adult orthodontics, definitely the correction does happen. It may not happen to 100% as what we are expecting, but it almost 80 to 90%, 70 to 80% correction is something that we do achieve with adult orthodontics as well. And it is almost a painless procedure now with the newer self-ligating braces that are available. And there are tooth-colored braces, there are invisible braces. There are different forms of, ways in which the tooth can be corrected. The teeth can be corrected orthodontically.
Great. So it's very nice that, all these things which are supposed to be malaligned, or maybe now the corrections are available at dental hubs like yours. So I would request parents, kids, in fact, even moms who are expecting should definitely visit Dr. Rashmi, because she will guide you as to when the child should actually come over for the first treatment, or at least to how the dental hygiene should be taken care of. So I think the child would be in proper hands over a period of time. with the guidance like this. Dr. Rashmi, I want to also ask you, like, are these implants, I'm talking about people who are very elderly, 65, 70-year-old gentlemen or women, very painful that, they may feel that, okay, how do I do it? It may transform their personality, no doubt, but are they painful?
See, dental implants are done under local anesthesia most of the times. Even if it's an elderly patient, it is done under local anesthesia. And the pain part, if you talk about, it's either the same or even lesser as compared to when, comparing it to the pain when a tooth is extracted.
Yeah.
So it's, age is definitely not, a criteria where implants will be contraindicated. Of course, there are certain medical conditions that, where we may not be able to place an implants, like diabetes mellitus, or, if you're a heavy smoker, then there are certain conditions where, implants may not be indicated for certain patients, but age is definitely not a contraindication. We've done implants for, for senior citizens who are as old as 80 years. And they're doing absolutely fine, and they're really happy with, and it really improves their entire look, their chewing capacity, the satisfaction of enjoying the food at that age. I think it's a wonderful feeling.
Very good. So actually they must be blessing you a lot for, first of all, the change in their personality and the kind of quality life which they lead. So a final question with you, doctor. In case there are schools approaching you, or like they would like to have some kind of seminars, or workshops, would you be interested that you would conduct it at schools in Dahisar or Borivali?
Sure, I mean, we'll definitely be open to this, where we can share some knowledge with the children, where we can guide them. We'll definitely be more than happy to join.
Yeah, Dahisar Connect plays a very important role, as a facilitator between schools and colleges in and around Dahisar. So if there are principals and parents who are keen that, we could have these kind of workshops, we could team up together, collaborate, and go to different schools, maybe say once in 6 months. If it comes, it is just a question where I feel it should be your comfort level, whether you are comfortable.
Yeah, sure. Definitely. I'll be more than willing to be a part of it.
The last question, as a pathfinder, see, we have started this thing, a concept where young generation are not sure as to what they should do in life. They would like to do something in as a dentist. They may not be a competition to you now because you already come to a very greater stage in life, a person who has already excelled in that. But would you advise the younger generation to go in for this profession? Because, they would be confident, yes, we have Dr. Rashmi Naik who could guide us. So what is your opinion on
that? See, taking up dentistry nowadays, parents or kids usually feel that, that's an easy way of, there's a lot of money involved, and it's not as, maybe it's not as difficult as MBBS. And that's why a lot of people opt for BDS. But let me tell you, like dentistry as a part of healthcare is more of an art and science. It's not just science, but the definition of dentistry itself, it says that the art and science of oral hygiene, of oral healthcare. So if you have the passion, you want to create something, you like to do something with your creativity. I think it's a wonderful profession to be in.
Yeah.
When you help people, when you relieve them of pain, the satisfaction is amazing. You really feel very good. But at the same time, when a patient walks out of your clinic with that bright, broad smile, that feeling is completely, you know, it's a different feeling altogether. So if you really have that passion for art, for creativity, and you want to, you know, be in a healthcare profession, then I would definitely recommend, like, dentistry is the career for you.
Great. I'm so happy that, you know, you're open to that, option where even parents could seek your guidance whenever they come even for their treatment. They can just ask you a couple of questions. Because of the Daisar Connect and a Pathfinder, you could be a mentor to them. They may not disturb you every now and then, but I think you can guide them. The reason behind it is, sure. Dr. Rashmi, you know, there was a time when I had a toothache long time back, maybe 15, 20 years back. And it was a Saturday night. And what happens is Sunday, the clinics are closed. You wait for the dentist to open and, you know, the shutter or whatever you call of the clinic. And when you do the treatment, you feel they are like a messiah. So I experienced that kind of a feeling in life, that dentists are like messiah when the person is actually, they are like God. When the person undergoes that pain in life, I really pray to the universal energy that everyone should be bereft of all this pain. They can have a beautiful set of teeth through you, but let the pain not be there, you know. That is what my prayers to God are. So I would like to thank you for your precious time given to Daisar Connect DC Celeb Talk. And if there are occasions where we would be conducting workshops at schools and colleges, please, I would be coordinating with you. Hope you're okay with that.
Sure, I will definitely be, you know, very glad to be a part of it.
Thank you so much, my dear viewers. Please feel free and meet up Dr. Rashmi Naik. She is just near Vitthal Mandir and in between the Siddhi Vinayak temple. It's on the main road. It's called Impressions Dental Hub. Just look up on the first floor of a building on the right-hand side and you will find that. So thank you very much, doctor, for your precious time. We'll catch up again.
Thank you so much.
Yeah.